Hi, thank you very much for the opportunity to be here. My name is Emmy Yang, and I'm a medical student in the U.S., in New York City. And it's my pleasure to speak to you today about the influence of urinary incontinence on the care dependence and caregiving in older women. Urinary incontinence, or UI, has been shown to affect the daily functioning of older women. However, we know very little about the risk factors that may lead older women to becoming dependent on the care of others. On the other end of the spectrum, there may be more functionally independent older women with UI who still serve as caregivers to other adults. And although there is growing concern about the health of informal caregivers in our aging population, there have been no prior studies that have examined the impact of UI on caregiving in older women. So our goals were to describe the prevalence of care dependence among older women living with UI in the community, to identify factors associated with increased care dependence among these women, and to examine the strength and direction of relationships between UI and caregiving in this population. We conducted a cross-sectional analysis of data from a national multi-ethnic cohort of older adults aged 57 years to 85 years at baseline of the study. Our analyses focused on the second wave of data in 2010 to 2011, where there was an expanded assessment of caregiving and care dependence. In total, there were 3,377 participants, and of these, 1,839 were women, and 1,703 had complete data on UI, caregiving, and care dependence. The mean age was 71 years old, and over a quarter identified as racial or ethnic minorities. UI symptoms were assessed by simple questionnaire measures during in-home interviews. Participants were asked if in the past 12 months they have had difficulty controlling their bladder, including leaking small amounts of urine, leaking when coughing or sneezing, or not being able to make it to the bathroom on time. Frequency of UI symptoms was also assessed with options a few times a day, a few times a week, a few times a month, or a few times a year, or not at all. Functional status was assessed by participants being asked if they had difficulty performing 6 activities of daily living, or ADLs, and 7 instrumental ADLs. Care dependence was defined as having difficulty with an activity, as well as reporting receiving help for that activity. Caregiving was also assessed by questionnaire. Participants were asked if they provided care to another adult because of age or disability. Of the 1,703 women, 59% were married or living with a partner. 59% reported UI a few times a year or less, which was considered minimal. 13% had UI a few times a month, moderate, and 27% a few times a week or more, severe. Over a third had difficulty with any ADL, and over half had difficulty with any IADL. This graph shows the prevalence of care dependence in the study, stratified by UI frequency. The greater the frequency of UI symptoms, the greater the proportion of women receiving help for both ADLs in blue bars and IADLs in gray bars. This graph presents the multivariable adjusted associations between UI and care dependence, with dark blue dots representing odds ratios and red bars representing the confidence interval. Women with moderate to severe UI symptoms had a 2.4-fold increased odds of care dependence for any ADL and a 1.9-fold increased odds of care dependence for any IADL. And this was after adjustment for age, race, ethnicity, education status, education level, marital status, and and self-reported health. Among the factors associated with increased care dependence, these were older age, being married versus being single, having worse overall self-reported health, and increased frequency of UI. Overall, about 15% of women reported serving as a caregiver to another adult, and this proportion did not significantly differ by UI frequency. This graph shows the proportion of women caregiving broken down by hours per day spent caregiving, with blue bars representing caregiving less than 4 hours per day, gray 4 to 8, and purple greater than 8 hours per day. We found no significant differences in caregiving hours per day by women depending on UI symptoms. Female caregivers with moderate to severe UI also reported lower overall health scores than women with minimal UI. And this was based on a standard self-reported health score where 1 was poor and 5 was excellent. In conclusion, older women with UI were more likely to be dependent on the care of others in order to live independently in the community, even after adjustment for other clinical and demographic factors. And at least 1 in 10 older women with UI still serves as a caregiver to another older adult, despite having worse overall health than caregivers without UI. Our findings support the need for more systematic assessment of the care needs of older women living in the community in order to both promote their independence as well as their ability to provide care to others. I'd like to thank you for your attention, and I would like to thank the researchers that made this work possible and the grants that also made this research possible. Thank you.
Questions or comments?
I have a question. So for your ADL measure, since a lot of times those will have continence built into that, did you adjust the ADL measure for that?
That's a great question. The ADLs that we were referring to are a standard list of 6 activities formulated by Katz and Lawton in the 70s. And they include activities such as eating, bathing, dressing, transferring from bed to chair, essential self-care activities, and using the toilet is one of them. And we did look at associations between UI and difficulty performing each of the individual activities. And we found that there was a significant association that wasn't included in the slides between having difficulty with all of the ADLs and having more frequent UI symptoms. Now, for the instrumental activities of daily living, which are activities that are considered to be important for one's independence living in the community, these are activities such as using transportation, cooking, managing money. These we also found a significant association with all of the activities except for, I believe it was taking medications and using the telephone. Thank you.
Hi, I'm Adrian Wagg, University of Alberta. When you describe dependence,
yes,
were you able to identify any patterns or any particular common areas where people were dependent that might enable, say, providers of care to target particular assessments to increase your return on investment if that's what you want to plan to do?
Yes, it's a great point. We weren't able to tease out that the reason for becoming dependent from the data. This was a secondary analysis of data from the National Social Life, Health, and Aging Project. But in terms of a future direction for this research, I would really like to understand, perhaps with a mixed method study, of why women become dependent, and also understand the caregiver perspectives for the experience of having UI while also providing care to another adult. Thank you.
Hi, Emma Nyström from Sweden. I was just wondering, so it increased the rate of dependence.
Mm-hmm.
Did you ask the women about their interest in care for their incontinence?
Interest in care for incontinence. That was also something that we weren't able to look at specifically based on the questionnaire results that were provided, but definitely something that I would have liked to look into. Thank you. In terms of knowing what incontinence medications they might be taking, or if they are seeking out behavioral therapies, that was not actually available in the study data. Thank you.
Okay. No more. Thank you very much.